So coming to the next topic about amputations. So it is amputation is cutting of the legs. 3Ds are involved. That is dead non-viable leg, dead viable but useless because prosthesis cannot be, it will be better, and deadly if it is causing threat to life. Dead non-viable, dead viable but useless, and deadly. Different causes. What is the need of amputation? If there is vascular, vessels are involved, bones are involved, infection, malignancy. If vessels are involved, non-vasculation, vascularized limb cases, acute limb ischemia. There is total ischemia of the limb. Chronic cases, ischemia is not indicated for revascularization surgery if there is not possibility of revascularization surgery. Orthopedic limb salvage has failed, limb is non-functional. Chronic non-union functioning. There is severe sepsis leads to death, non-vital gas gangrene or something like that. Malignancy, you have to go for amputation. Different types of amputation, as the vast majority of commonly performed amputation affect the lower limbs. Basically, commonly for the lower limbs. This will be discussed here. Hip disarticulation, right from the hip, you can see the levels. There is disarticulation at the level of hip. It is also called as hind quarter. This is knee joint, above knee. This is transfemoral. This is femoral bone. You cutting from the above knee, save patella, above knee amputation. Then Sims amputation at the level of ankle, and below knee. This is below knee and forefoot amputation. So what you do, disarticulation, hand cutter, above knee amputation, transfemoral, easy and good healing. Here you get fish mouth. Fish mouth. These are incision is like this, bone is like this inside. This is the fish mouth design. Through knee, it is also called as gritty stroke. Through knee, when you are going to this is called as gritty stroke. It is faster, and but patella is saved here. Patella is not cut. Remove the femoral condyles. Condyles need to be removed. Patella is saved. Below knee. So there are two flaps. When you go for below knee amputation, there are two flaps. Burgess flap. The flap is like this. Posteriorly, flap is raised. That is called as Burgess. And skew flap, fish mouth flap or lateral flap. This again fish flap. This is called as skew flap and Burgess flap. Sims amputation through ankle. You have to go through ankle joint. Okay. Then through the ankle amputation. Forefoot amputation, remove all the toes and head of metatarsal. Laterally, if you see talus, calcaneum, navicular, metatarsal like this and this. If you want to go for amputation, forefoot, remove all the toes and head of metatarsals. These are toe and heads. This is forefoot. Front part of the foot. Forefoot amputation. Ray amputation, any single toe is removed. If any of this metatarsal, tarsal bones. So in this, if you are removing only this much part, this is called as ray amputation. Choosing the level of amputation. Which level you will choose? Disease process being treated. Desired function. What is the, whether you are able to treat the disease process. Where is the blockage of the vessel, and distal to that you have to do. And second thing is function has to be there. So if you do below knee amputation, the stump has to be such that person should be able to stand. And comorbidities. Patients with fixed deformity of the knee joint. If there is a deformity of the knee joint, the distal joint after the amputation has to be, means the immediate proximal joint from the amputation has to be working. Distal is removed, proximal has to work. So if knee joint is already at deformity is there, so you can't go for below knee amputation, you have to go for above knee amputation. So this was about the amputations.